Welcome back to The Ed Show. If you pay attention to media in America, if you pay attention to media on a day-to-day basis, you know who this guy is. That's Glenn Beck. Very successful radio broadcaster for years, very successful television broadcaster, very successful businessman. He's done well for himself. God bless him. In fact, most people in front of the camera have done pretty well in this industry, and most of the people in this business have got health insurance. I think Glenn Beck has done the country a real favor. This story is not about personality bashing or not about media confrontation or any of that. Beck revealed something very personal on his broadcasts in recent days. Glenn Beck just added, I think, a very important personal note to the nation's conversation on illness and solutions and where do we go from here. Beck is wealthy, he's successful, and highly visible. Think about that. A very highly visible person in the media with plenty of wealth and the ability and the wherewithal to get the attention has come forward to tell his story. There's a lot of people behind the camera that can't do that. Now, he's so highly successful that sickness, of course, well, sickness doesn't know wealth. Sickness doesn't care about your success. Beck gave his firsthand account.
About 5 years ago, right around the time we met in Washington, D.C. for 828, I had begun to have a string of health issues that, quite honestly, has made me look crazy. And quite honestly, I have felt crazy because of them. My hands or feet or arms and legs would feel like someone had just crushed them or set them on fire or pushed broken glass into my feet. I hadn't had any even real REM sleep in maybe as long as a decade. Macular dystrophy and the vocal cord paralysis. Something was happening to my body. I was going into a seizure-like state. This is me actually coming out of a surgery. About 18 months ago, I checked into a hospital in New York City for some extensive testing. I had some of the best doctors in the world look at me.
Pretty scary. You can almost hear the fear in his voice. He's certainly been through quite a medical ordeal. While plagued by illness, Glenn Beck was able to find care.
I found the Carrick Brain Center. They engage in experimental therapy. You know, the stuff the government and the insurance companies aren't sure that they believe in. And because of that, they don't take insurance, and they cost quite a bit of money, and they don't make any promises. They found that I had several things going on, from an autoimmune disorder to adrenal fatigue. My doctors told me that it was my faith in God that was powering me through all of this, that I shouldn't be standing, that if I would have stayed in New York City, they didn't think I would be alive today. After months of treatment and completely changing the way I eat, sleep, work, and live, along with ongoing hormone treatment and intensive physical therapy, I have reversed the process.
Glenn Beck hasn't named his exact diagnosis, but says specialists found an autoimmune disorder and adrenal fatigue similar to Addison's disease. As Glenn Beck suffered excruciating pain, he had access, and he had opportunity to visit several doctors and undergo rounds of testing. He was offered treatment and guidance. Glenn Beck found help because he could afford it. Someone without insurance would not have the resources to see any doctors at all. Now, listening to Beck, can you imagine what that would be like? The Affordable Care Act, which the Republicans hate, give the American people an unprecedented opportunity for care. But Beck telling this story, I think, is powerful because it brings us right to the crossroads where this country sits right now. How do you say no to your next door neighbor because they have a pre-existing condition, maybe like the one Glenn Beck has? How do you vote to take away insurance where you couldn't go see any doctor to get a first, second, or third analysis of what you're going through? I don't know Beck. I have no desire to know him. I've had my battles with him over the years. No big deal. It's media mudslinging, whatever. But I'm curious about his motivation for sharing this illness with his viewers and the people that basically are followers and worshipers of what the guy says and does. I hope that his story motivates those who think that Obamacare is bad, that maybe that they will rethink the situation, that seeing a doctor and having it covered is paramount to a good life, to a chance at a good life. And from a man who has had sickness in his family, I can tell you, insurance is one hell of a thing. Being denied is the worst. There is a chance here, I think, for a better dialogue between conservatives and liberals on what we're going to do in America. What is our moral fiber all about? Beck mentioned God. We did our share of praying as well and do every day. That's important. But what's really important is that we don't say no to our fellow man and that we have compassion within our heart to solve this and not let it become personality bashing and not let it become something that is going to be a political victory because we're so concerned with who might get the political credit in the long run. I have thought for a long time that all this president wants to do is try to deliver hope to people. And in the form of health care, when he took office, there were over 50 million people in this country that didn't have it and couldn't get it and were denied, and we're turning that worm. But now we finally have someone of wealth in front of the camera who is willing to come out and give a testimonial, open up his life to people across America, and let us re-examine who the hell are we? And why are we voting to take away things from Americans who are sick? It makes no sense. And on Veterans Day, a day where we honor those who are unselfish and did the unthinkable so we could stand here in front of a camera and talk, maybe we can find it within ourselves to have the party in power say, we got something better than Obamacare. That's what I want to hear. As an American, okay, you won the election. Let's have at it. Let's do Obamacare, health care, whatever you want to call it. Let's do it all over again because the American people want coverage. And the American people, really, if you poll them and pay attention to them, it's universal health care. Joining me tonight is Wendell Potter, senior analyst for the Center for Public Integrity. Mr. Potter, good to have you with us tonight.
Thank you, Ed.
What is the Republican plan for health insurance? Nonpartisan, let's say this is a nonpartisan question. I'm curious, what do they want to do? Do you know?
No, I don't. I don't think they've shown a plan for a long time, except to suggest a few things that that really wouldn't work. They've said that we need to have more high deductible plans and have tort reform and things like that, but not a real coordinated plan. That's the problem, and that's why we didn't really have an alternative during the whole healthcare reform debate. There was really nothing that they brought to the table that was all that different. Keep in mind, however, that a lot of the elements of the Affordable Care Act did contain some Republican ideas. The individual mandate, for example, was what came out of a Republican think tank several years ago. So it really was bipartisan legislation. They just have never really owned up to it.
Is there a chance that the Republican majority could go back and redo health care with their decision makers and come up with something that would make what we have right now better?
I don't think so, Ed, because the Affordable Care Act, again, is built on this Republican idea of requiring all of us to have health insurance. The Republicans want to make sure that we have competing health insurance companies. The only way that they can stay in the game and can offer policies to people who've been sick in the past and people who are currently sick is to require that all of us be in the pool so that young people and healthy people are also getting insurance and paying for it, so that the folks who really need it, people who are sick, can get it and afford it. If Mr. Beck had been just a regular person when he got sick, chances are he would have been declared uninsurable by insurance companies. I know this from the years that I worked in the industry. He simply could not have gotten insurance because of his pre-existing condition. And chances are he would not be alive today as a result of that if he didn't have the wealth that he has.
That is what Congress has to think about when they start thinking about taking away things from American citizens. Mr. Potter, good to have you with us tonight. I appreciate your time. Thanks so much. Coming up, Republicans take another punch at the Postal Service. We'll tell you about the latest attack on the American institution. Keep it right here. We're right back.